manufacturers are working on what I'll call the next generation of coronavirus vaccines, including pan-coronavirus vaccines that can handle not just the Omicron variant, but potential future variants. But I think you're highlighting and underscoring in your previous reporting as well about the antiviral pills, Pfizer and Merck, incredibly strong data from both of those oral pills, 5-day regimens. Not, very convenient because you can just get it in pill format, never have to go to the hospital or to a doctor's office, just by prescription. So I think it's very important to keep in mind that 2022 is very different, not just because of vaccines, but to your point, therapeutics, both in and out of the hospital. And that can really become what I hope is a game changer. But we're going to have to watch for worldwide approval of these drugs and also global manufacturing. There won't be incredible volume in the beginning. In the United States, we also have a shortage, even though those products are authorized for use in patients. But we're hoping by the second quarter of this year that we'll have sufficient supply for even for Tanvir or Tamer, for anyone to call and get a prescription if they have a positive, but they don't need it quite yet, but can take it in the first several days.
Perhaps the biggest problem, the biggest challenge ahead is public perception, isn't it? I mean, so many of the populations around the world are suffering from fatigue over this and really letting their own behaviors drop. And in the US, as we saw in the report a moment ago, the distribution of free masks and testing kits is only just getting underway at a time when people do seem to be less inclined to really pay attention to what's going on. How big a challenge is public perception?
Yeah, I think it's a huge challenge. If there's one thing that even I did not factor in was the kind of social psychology of the situation. We've talked so much about science and public health, and we've wanted to let science lead. That's the right frame of mind. But what we're forgetting is that people are human and behavior gets in. So you can have people like me, always vigilant, wearing a mask, trying my best to not get infected. And then this is a highly infectious variant, and many of my colleagues are getting infected, don't know how, and they're shameful, they're fatigued, they're frustrated. So I think you're bringing up an important point that we're going to have to just be very cognizant of the behavioral psychology. And that means that our messaging needs to be different. We need to acknowledge the fatigue, and we need to recognize that people are only going to do so much if you don't give them that light at the end of the tunnel. So we need to be clear about when you don't need masks. We need to be clear about when an asymptomatic positive does not pose a threat to you or to your household. And those are the clear messages I think we need this year.